Hi, and welcome to Elementally Healthy, where we talk about all things science. Our episode today is also brought to you by Virtual Dermatology PLLC, which brings customized specialist coaching to primary care clinicians, pediatricians, and rural healthcare providers. I'm your host, Nicole Gentile. I'm a tenured dermatology PA, psychoderm clinician, nutrition and life coach, and a Reiki master teacher. Sounds like a lot to unpack, and for 15 years, as I've helped patients connect the dots between what's happening inside as well as around their bodies and what they see on the surface. So, needless to say, we've got a wide breadth of what we cover here, but the common denominator always boils down to you, your physical, emotional, and at times even your spiritual health. But today we are going to focus on one of my favorite, more biological, scientific topics, the skin, and diving a little deeper specifically, your pigment. We're going to discuss how pigment cells, inflammation, and stress chemistry communicate, and why the global obsession with brightening products doesn't always match the science. So, first, let's see if you can relate. Have you ever looked in the mirror after a long week, kind of where I'm at right now, and thought, why does my skin look different? Maybe you notice a little bit of blotchiness after an eczema flare. Maybe you're looking a little dull. Maybe you're noticing that stress seems to darken certain spots or make white patches more obvious. Well, it's not your imagination. That's actually your melanocytes talking. So now let's give some context. The hashtag hyperpigmentation treatment has over 250,000 posts on Instagram. That's a lot. So it's part of an industry worth over $6 billion a year. And when you add up procedures, serums, and creams, all promising to even skin tone and fight hyperpigmentation, that's a buzzword now. Here's the truth from inside the exam room. Not all of them work, actually. I would say very few out there do, and most miss the actual biology behind pigment change, unless you're dealing with a board-certified dermatologist. But let's just unpack what your melanocytes are really doing and how to keep them balanced instead of over or underreactive. Before we start, I do need to give a quick disclaimer. This episode is for educational purposes only. It does not create a provider-patient relationship, and it should not replace medical care or a prescribed treatment plan. All right, let's talk about your pigment producers. So melanocytes are the pigment-making cells of the skin. Most of us have heard of them before. Well, these are the cells, the ones that most people blame or target when hyperpigmentations show up. So we often talk about them like they're these simple factories that just pump out melanin. But what I want you to really hear is this. Melanocytes are doing far more than controlling your skin tone. They are incredibly dynamic, intelligent cells that play a role in multiple systems in the body. This is where I start geeking out. So first, let's ground ourselves in where melanocytes live. So they're found along the basal layer of the epidermis, which is the bottom layer of the skin's surface. So you have your epidermis, dermis, and then subcutaneous. You will also find them in the hair follicles. These melanocytes package melanin into tiny pigment packets called melanosomes, and then they hand them off to neighboring skin cells called keratinocytes. Together, they form what's known as the melanocyte-keratinocyte unit. And this is essentially a partnership that determines how pigment is produced, how it's stored, and then displayed across the skin. But this is just the beginning. So melanocytes are not passive. They are very active participants in both the immune system and the nervous system of the skin, besides the skin. Yes, your pigment cells are listening. They're responding and communicating with the body on levels that most people never talk about. Melanocytes can sense when something's wrong, like infection, inflammation, or injury, and they can respond. They release signaling molecules, they manage oxidative stress, and even participate, it's been a long day, and antigen presentation. And this is a key part of how the immune system recognizes threats. That means that melanocytes don't just react to inflammation, they can actually influence it. And here's where this becomes fascinating. Melanocytes and the nervous system share an origin story. So during early development, back when you were just a little forming ball of tiny dividing cells, melanocytes originate from the neural crest. This is the same embryologic tissue that forms peripheral nerves and Schwann cells. So it makes sense that melanocytes are wired into the nervous system. These are important parts of your peripheral nervous system. They're built to listen and respond to nerve-derived signals, including the chemistry of stress. Now, I want to pause for a second because this is where most people, and even many of my skincare professionals, get surprised. Your skin isn't just reacting to the outside world. It's constantly interpreting and responding to your internal world, including physiological stress. Now, when I say physiological stress, I'm referring to measurable biological stress pathways, not just the feeling of being emotionally overwhelmed. Emotional experiences can activate these pathways, but what I'm talking about here are the actual chemical messengers. These are the neuropeptides, neurotransmitters, hormones, and immune signals that circulate or generate in the skin and influence how cells behave. So the skin actually has its own mini stress response system. It's often described as a cutaneous equivalent of the hypothalamic pituitary adrenal axis, your HPA axis, which is your body's main stress regulator. That means that skin is capable of sensing stress, responding to it, and even remembering it. So have you ever heard someone say, "I've been stressed, and now my skin is really flaring"? Well, most people assume that it's a coincidence or it's just a saying. I've even met some dermatologists that think it's just a saying. But there is physiology behind it. So when the body is under stress, the nervous system releases neuropeptides like substance P and CGRP right into the skin. These chemical messengers talk to immune cells, blood vessels, and yes, melanocytes. At the same time, CRH and ACTH, which are stress hormones, can be produced locally in the skin or circulate systemically. These signals can shift how melanocytes function, increasing pigment production in some patterns and decreasing it in others. So, if you've ever noticed pigment changes during or after times of physical or emotional stress, this might be why. Now, let's bring in the immune system for a moment because this is the third piece of the puzzle that we need to talk about. The skin is an immune organ. It's your first line of defense. And melanocytes are more than just bystanders when the immune system has to get involved. They are communicators. So one way that melanocytes do this is through receptors on their surface. These are called toll-like receptors or TLRs. So I want to try to explain this in a way that is simple and visual. So let's think of toll-like receptors as the security sensors of your immune system. They sit on the surface of certain cells, including immune cells and melanocytes, and they're constantly just scanning for signs of danger, whether that's bacteria, viruses, or damaged cells. So each toll-like receptor recognizes a different type of threat pattern. So one might detect bacterial toxins, another might recognize viral RNA. And when they detect something, they activate a response. In a sense, they're sounding the alarm for the immune system to then get involved. Okay, so I want you to imagine that your home has different alarms. There's one for smoke, one for broken glass, one for a forced door. They all call the same emergency responders, but they detect different triggers. So toll-like receptors work the same way in the skin. So hopefully that visual kind of helped to understand how this immune process works. Well, this becomes important for pigment because when melanocytes detect stress or damage through these receptors, they can then change how much pigment they produce. And they can change how they choose to distribute it. And if the immune system gets heavily involved, it can either overstimulate melanocytes, leading to darkening, or it can target them, leading to pigment loss. So let's just zoom out for a moment so we can connect some dots. All right, at this point in our conversation, you know that melanocytes are not just pigment makers, right? They are neuroimmune communicators. You also know that the nervous system, the immune system, and melanocytes talk to each other constantly. And then physiological stress signals can actually influence pigment, inflammation, and barrier function. And physiological stress signals can show up in a lot of different ways in the body. But this just means something really valuable for you to understand, that pigment changes are not random. They are the visible and quantifiable evidence of a conversation actually happening within your skin. Now that we've set the foundation, I want to walk you through how this neuroimmune pigment conversation actually shows up in real skin conditions, some that you can probably relate to. Because once you see the patterns, you'll never look at hyperpigmentation the same way again. And you'll understand why the most effective treatment plans don't just lighten pigment, some of them also address why the pigment shifted in the first place. So let's start with a condition that most people have heard of, even if they don't fully understand it, and that's vitiligo. Vitiligo is a condition where the body's immune system mistakenly targets and destroys melanocytes. These are the cells that we've been talking about, the cells responsible for pigment. It leads to well-defined white patches on the skin that can gradually spread over time, and it can be very troublesome to the patient. And this is not a surface level issue. Vitiligo is a perfect example of what happens when the immune melanocyte conversation breaks down. So, research shows that a key player in vitiligo is interferon gamma. This is a pro inflammatory cytokine that helps activate the immune system. Interferon gamma triggers a pathway called JAK-STAT. And when that pathway is active, it drives T cells to actually attack your own melanocytes. There's also evidence that oxidative stress, basically that's an imbalance between free radicals and antioxidants in the skin, may act as an early ignition spark. That oxidative stress can prime melanocytes for immune attack, making them more vulnerable. If you've heard of a medication called Opzelura, which some of you might have heard of, I feel like it's got pretty good branding. This cream gained a lot of attention for this reason because it basically is a JAK inhibitor. And when applied to areas of vitiligo, it actually helps to interrupt that JAK-STAT inflammatory signaling pathway that leads to this melanocyte loss. In simpler terms, it quiets the immune attack so melanocytes have a chance to return and repigment. I actually like to combine it with tacrolimus, and we can kind of talk about that a little later. But another therapy that's been used for years, especially for more widespread vitiligo, is narrowband UVB phototherapy. UVB helps to guide melanocytes back into the skin and restart melanin production, but it also calms immune activity. So for small areas or sensitive zones, dermatology providers sometimes use topical steroids or even calcineurin inhibitors to reduce local immune attack. We have a lot of different options. And then in more specialized cases, and this is rare, there are surgical options or systemic JAK inhibitors, but those decisions do need to be made with a dermatologist who is experienced in vitiligo care. They need to be handled with care. So vitiligo is a great example of pigment shifting down because the immune system is targeting melanocytes. Okay, so now let's shift to something that I see constantly in clinic and that many people confuse with scarring. This is post-inflammatory hyperpigmentation. We're going to refer to it as PIH because that's our lingo in the derm world. So if you've ever had a breakout, a rash, bug bite, scrape, or eczema flare, and then weeks later you're left with a brown spot or a really dark red spot that just won't fade, that's PIH. So I have so many parents and patients come in and they're concerned about scarring after a breakout. And most of the time, what we're looking at is this post-inflammatory hyperpigmentation. So I can reassure them that it's not scarring. I sometimes call it the ghost of pimples past because it's like a memory of inflammation in the skin that the skin hasn't fully let go of. So here's why PIH happens. When the skin becomes inflamed, it releases chemical messengers called cytokines. Remember those immune alarm bells that we talked about just a little bit earlier? Well, some of those messengers stimulate melanocytes to produce extra pigment. And that extra pigment can disperse unevenly. And depending on your skin tone and genetics, it can stick around for weeks to months, sometimes even longer. The good news with PIH is that it's usually reversible, but fading can take time, and then protecting the skin during that process is absolutely crucial. Step one in any PIH treatment plan is always, you guessed it, sun protection. Ultraviolet light and even high energy visible light, even light from your computer screen and artificial office lighting, that can refuel pigment. And then it can darken those spots. So a daily broad spectrum sunscreen is essential. And for skin of color, tinted mineral sunscreen with iron oxides offers added protection against visible light that can drive hyperpigmentation even deeper for those especially susceptible. Now, for a handful of my favorite clinically recommended SPFs, visit my webpage at elementalhealingsolutions.com and then click that tab labeled skin to find effective mineral-based blocks that won't leave you looking ghosty or greasy. And depending on your skin type and tolerance, dermatology providers often use ingredients like topical retinoids, azelaic acid, cysteamine, or hydroquinone to help fade that pigment more quickly. But here's the part that most people forget. If you don't treat the underlying cause of inflammation, whether it's acne or eczema, PIH is going to keep showing up. That means that managing the psoriasis, the irritation, or trigger that caused the inflammation in the first place is crucial. And for some patients, chemical peels or laser treatments can help, but they really need to be chosen carefully, especially for richer complexions, because the wrong treatment can 100% increase inflammation and cause rebound pigmentation and make things worse. I've definitely seen this. Now, speaking of stubborn pigment patterns, let's talk about melasma. This one has a special place in my heart, and maybe heart isn't the right word because melasma and I have had a long and complicated relationship on my face. I developed melasma during pregnancy with my middle child, who's almost 10 now, and I know firsthand how emotionally draining and persistent it can be. Melasma is much more than a cosmetic concern. It can affect self-esteem, confidence, and quality of life. Melasma shows up as symmetric brown patches, usually across the cheeks, on the forehead, or the upper lip. And it's strongly influenced by sun exposure. It's also influenced by heat and hormones, particularly estrogen and progesterone, which is why it often appears or worsens during pregnancy or with birth control. Now, don't get me wrong, males can be affected by this too. Yay, melasma for everyone. But newer research also points to vascular and inflammatory components, as well as potential neuroendocrine influences and changes in the skin barrier that make the skin more reactive to triggers. Because melasma is so sensitive to light, not just UV light, but also heat and visible light, rigorous photoprotection is the foundation of treatment. Think tinted mineral sunscreen with zinc or titanium dioxide, hats, shade, fans, and avoiding infrared heat exposure when possible. Treatment is often layered and long-term, emphasis on long-term. Some people use topical hydroquinone, and clinicians, let me tell you, we got to be pulling out the 8 to 12% for some presentations, often in combination with a retinoid and a low-strength corticosteroid. This is what we call triple therapy. Others prefer non-hydroquinone options like 5% cysteamine cream, azelaic acid, or tranexamic acid, which can be used topically or in low-dose oral form under medical supervision. I will say that not everyone is a candidate for oral TXA because its main purpose is directed at increasing clotting. So don't be getting your script online, because if you have a clotting issue, meaning you're prone to clots like factor V Leiden mutation, this one is not for you. I've personally seen excellent results with transdermal delivery of TXA using microneedling. When done by a trained professional, this allows the ingredients to reach that level where the pigments produce, where it lives in that basal layer, making it far more effective than topical application alone. Laser and light-based treatments for melasma can be a bit tricky. Some can help in select cases, but too much heat or aggressive energy can actually make melasma worse. A general rule with melasma is if the treatment causes heat or inflammation, you might get a temporary improvement through peeling, but long-term rebound with healing. So melasma treatment requires patience, persistence, and maintenance, even after results are achieved. Now, I want to share a last example that beautifully it illustrates how pigment, nerves, and development are connected. And that's neurofibromatosis type 1 or NF1. NF1 is a genetic condition caused by a mutation in the NF1 gene, which normally helps regulate cell growth. When the gene isn't functioning properly, cells can grow uncontrollably. This leads to benign nerve sheath tumors called neurofibromas. People with NF1 often develop cafe au lait macules. These are light brown patches on the skin. We see them a lot even in people without NF1. This comes along with freckling in the armpits or groin and multiple soft skin nodules. This condition is usually diagnosed in childhood and can vary widely in severity, ranging from mild skin findings to a more significant neurological involvement, which is a little more rare. But for our purposes today, what's important to recognize is that NF1 reminds us of the shared developmental origins of melanocytes and nerve tissue, which is further evidence of how pigment and the nervous system are intertwined. All right, now that we've walked through examples of pigment shifting up and down based on immune and neural influences, I want to talk about the most powerful approach when accessible, and that's preventing the pigment shift in the first place. Because once pigment rises to the surface, we can treat it, but preventing that shift is almost always easier than reversing it. When I say prevention, I don't mean ignoring pigment until it shows up. I mean supporting the skin in a way that reduces the likelihood of melanocyte activation to begin with. And there are 4 pillars that we need to think about here. So let's just keep it simple with these 4 rules. Number 1, protect the skin barrier. A compromised barrier makes the skin more reactive, more inflamed, and more prone to pigment changes. Gentle cleansing, moisturizing, barrier supporting ingredients, and avoiding unnecessary irritation all help to keep the skin stable. I have some great blog posts that walk you through this process and teach you the pillars of barrier support, as well as links to easy to find and affordable over-the-counter products that I frequently recommend in clinic. So I'll be sure to add those to our video notes. Now, number 2, you want to reduce UV and visible light exposure. So this is the trigger for many pigment conditions. Sunscreen, shade, hats, tinted mineral formulations, these are truly non-negotiable, especially for those prone to PIH or melasma. And third, rule number 3, calm inflammation early. This is a big one. Don't wait for acne, eczema, rashes, or irritation to run their course. If you have a treatment plan with a provider, just start it right away. And if you've yet to establish a plan with a provider, get in and see a board-certified dermatologist to manage your condition effectively and efficiently. We don't want to allow that fire to burn because the longer it burns, you're going to have a very clearly demarcated fire pit in its wake. Time is definitely of the essence, so treating inflammation early can prevent the melanocyte response that then leads to the pigment changes. And finally, 4, address physiological stress. And I'm choosing those words intentionally because psychological experience can activate biological stress pathways. But what we focus on here is the measurable physiology, the neuroendocrine immune signals like CRH, ACTH, cortisol, substance P, and others that can influence skin behavior. Now, I'm not suggesting that mindfulness or stress reduction replaces medical therapy, but I will tell you this. In my clinical practice and supported by emerging research, when we support the body in regulating physiological stress responses, whether through sleep, movement, nutrition, breathing techniques, cognitive behavioral strategies, or psychodermatology aligned coaching, we often see skin conditions flare less intensely and less frequently. So, bringing all of this together, here's what I want you to take away. Melanocytes are not simple pigment cells. They are neuroimmune communicators. Inflammation and stress signals can push pigment up, like in PIH and melasma, or down, like in vitiligo. And treatments work best when we match them to the dominant pathway, which could be immune modulation, light therapy, inflammation control, pigment suppression, and or barrier support. And prevention through barrier protection, early inflammation control, photoprotection, and stress pathway regulation is often the most powerful tool. So, if you found this helpful and you want more skin science that blends dermatology, research, and real-world clinical insight, I would love for you to stay connected. You can follow at My Virtual Derm on Instagram for more skin education, subscribe to my podcast or YouTube channel for deeper dives, or book a consult if you'd like dermatology-informed skincare and coaching tailored to you. Your skin is constantly speaking, and the more we learn its language, the better we can support it with clarity, compassion, and science. Thank you for tuning in and listening to what your skin has to say. I am your host, Nicole Gentile, and I'm wishing you the best of health and fulfillment wherever you find yourself today. And as always, fuel yourself with only the best information, nutrition, and relationships with yourself and others, and feel great.